Sometimes improving your sleep isn't just about what you're doing right, but it's identifying what's getting in the way. So let's break down some of the most common sleep disruptors. 1. Life stage disruptors. Pregnancy and parenthood can throw sleep into chaos. Hormones, discomfort, night feeds, worry. Welcome to the 3 a.m. club. 2 is menopause. This can bring hot flushes, night sweats, rising anxiety, and as estrogen drops, so does your sleep stability. And then with aging, sleep tends to get lighter, people wake earlier, and medical issues can often interfere. Shift work is another one. It's like permanent jet lag. Your body clock is out of sync and it feels awful. As I say, I hated night shifts to this day, and I respect and I thank all of you out there who are doing them. You are stronger than me. Even pets can cause sleep disruption. Snoring, scratching, taking over the bed. As a child, I had a ginger cat called Bugsy, and he always used to sleep on my pillow, so I had to have an extra pretend pillow that he could sleep on just so that I could get some sleep. Substances, caffeine, alcohol, late night snacks, they all interfere with these natural rhythms. Stress and environment. It's too hot, it's too bright, it's too noisy, or there's just too many tabs open in your brain. All of these will add up. But what if you've made all the right lifestyle changes and the sleep still feels like a nightly battle? That's when we start thinking about sleep disorders. So we're going to go through them, the most common ones, plain and simple. Number 1, insomnia. If you struggle to fall asleep, stay asleep, or wake up too early at least 3 nights a week for more than 3 months, and it's affecting your daily life, that is the clinical classification of insomnia. You're tired but wired, you're foggy, you're frustrated, and the harder you try to sleep, the harder it gets. And the good news, cognitive behavioral therapy for insomnia, or CBT-I. It's a proven long-term treatment, no sleeping pills required, and it's actually been shown to be more effective than sleeping pills. Parasomnias. These are strange things that happen between the sleep stages: sleepwalking, sleep talking, night terrors, or acting out vivid dreams. Sometimes disruptive, sometimes dangerous, but they're often treatable. Obstructive sleep apnea, or OSA. If you snore loudly, wake up gasping or choking or feeling exhausted despite sleeping 8 hours, you might have sleep apnea. This means your airway is closing off during sleep, often hundreds of times per night. Your oxygen drops and your brain is waking you up time and time again to breathe. Left untreated, sleep apnea increases the risk of high blood pressure, stroke, and memory problems. The solution? Simple home sleep studies and effective treatments like CPAP therapy are available on the NHS and privately, and there are now also devices that you can use in your pallet. Restless leg syndrome, or RLS. This is a neurological condition that causes crawling, tingling, or pulling sensations in the legs, especially in the evenings. It's only relieved by movement, making this impossible to rest. It's often linked to low iron, kidney disease, or certain medications, so it's worth getting checked out if you think you're suffering from this. Narcolepsy, a rare but serious condition causing sudden sleep attacks during the day, muscle weakness triggered by emotion causing cataplexy, and vivid dreaming the moment you fall asleep. It's often missed for years, but it is treatable with medication and structured routines. So, how do you get diagnosed? If you're in the NHS, start with your GP. They can refer you to sleep clinics for insomnia, parasomnias, sleep apnea, or restless leg syndrome, neurology for narcolepsy and complex cases, and then there are the mental health services for CBT-I, cognitive behavioral therapy for insomnia, or anxiety-related sleep issues. If you're going private, you can book with a sleep physician, respiratory consultant, a neurologist, or even the CBT-I specialist. Home sleep studies are now simple, fast, and they are accessible. Do you need help tracking your sleep? These are some tools that can help. 1. The Epworth Sleepiness Scale is a measurement of how likely you are to doze off during the day. 2, the Insomnia Severity Index. This helps assess how disruptive your sleepiness is. 3, Stop Bang. This screens for snoring and sleep apnea. 4, the Pittsburgh Sleep Quality Index gives your sleep a report card. And 5, the Morningness Eveningness Test maps your chronotype. Final thought, if you've done all the right things and you still feel awful, don't guess, just get assessed. Sleep disorders are common, and once you name them, then they're often very treatable.